What's up everybody, my name is Eric. Welcome to my channel, Eric the Tutor. What's up everybody, my name is Eric. Welcome to my channel, Eric the Tutor. Today we're going to be going through practice problems, getting ready for lecture midterm number 2. And we're just going to be working through practice problems just like we did for the first midterm. The hope is to try to get even more practice problems out this time. So expect to see videos hopefully daily. So let's go ahead and get started. So a patient is experiencing shortness of breath. The x-ray reveals, I should tell you that the patient has a pneumothorax. Okay, so the patient has a pneumothorax. So now that we know that the patient's having a pneumothorax, do you think that there's fluid buildup somewhere, or do you think it's air that has entered? Yeah, so pneumothorax, not going to be fluid, so we can cross off answer choices A and B, right? Because it's not fluid entering anywhere. It's actually air that is entered in. So maybe there was some sort of wound, maybe there was like a gunshot wound or something where the lung has actually deflated, right? And the reason for that is because air has entered into a specific cavity that we learned about, and that pressure has equalized with the atmosphere. So no longer is the lung able to stay inflated. So it has something to do with air. Now, air superficial to the parietal pleura? No, we talked about a specific cavity. So we're looking for pleural cavity. Pleural cavity. So can't be superficial to the parietal pleura. Maybe if it said deep to the parietal pleura, so it can't be that one. And then D, air, which must be removed by passing through both visceral and parietal pleura. Can't be that one either, because we don't want to go past the visceral pleura, right? Visceral implies that we're actually on the lung. We want to go in between that potential space between my visceral and parietal pleura. So it's got to be E, which says the air must be removed by entering the space between the visceral and the parietal pleura. That's exactly what the pleural cavity is. That's the answer to this question. High yield question. Pneumothorax usually is even one of the case studies, so definitely a very popular question that might come up. All right, thanks guys. We're getting ready for our lecture 2 exam, and I put up a nice practice problem for you that is something very relevant that you might see on your exam. So I have the fossa ovalis is located blank, and its fetal structure is the blank. So go ahead and try to answer that, pause the video, try it out, and then we'll talk about it together, okay? All right, so the fossa ovalis is located, so where's the fossa ovalis located? One, I mean, if we can answer that right off the bat, then we can cross out all the problems. But we'll go ahead and start with maybe the latter part. So it says its fetal structure is the blank. So fossa ovalis, let's just go through all of these questions and see what we can do, okay? So ductus venosus is going to be an answer choice here. We have ductus arteriosus and then the foramen ovale. So these are all different fetal structures. So one, if we're thinking of the placenta is going to have oxygenated and nutrient-rich blood coming from the placenta, coming from mom, and that blood is going to be sent off to the baby, right, during our fetal development. So let's talk about the ductus venosus. The ductus venosus versus the ductus arteriosus. You can think of the ductus venosus as essentially the blood that's bypassing the liver and going straight to the baby's heart, right? So it's not going through the liver because the liver isn't yet developed. So there's no reason for that blood to go through the liver. It's actually going to be shunted. It's going to be bypassed. So it's not going to go through that liver. Thanks to an umbilical vein, it's going to drain directly into the IVC. Okay, so that's the ductus venosus. But here we're talking about the fossa ovalis, and I know that structure is somewhere in the heart, so I'm going to go ahead and cross out these answer choices. So once that blood goes to the IVC, it's going to go where? It's going to go to our right atrium, right? Because we have 3 things that are going to be dumping into our right atrium. We have our superior vena cava, inferior vena cava, and then we have our coronary sinus, right? So all of that's going to be draining into our right atrium. Ductus arteriosus is essentially that blood is traveling through the right atrium, and then we know the pathway it might take. If it goes into the right ventricle, then it's going to go out into the pulmonary trunk and then out to the lungs, right? But since our baby's lungs aren't developed, that there's going to be a bypass going from the pulmonary trunk straight back to the aorta. So our ductus arteriosus actually will shunt blood from our pulmonary trunk, and it's going to send it straight to the aorta so it can go out to the rest of the body. So that's what the ductus arteriosus is doing. But again, not relevant for our question because I know we're talking about fossa ovalis. So kind of similar fetal structure, but not exactly what we're looking for. Also, I can cross out all these answer choices because I know it's not in the arch of the aorta. I know it's not in the mitral valve or any of the walls of the ventricles. I actually know it's going to be in my interatrial septum. So I can cross off the interventricular septum. That foramen ovale is actually in my interatrial septum, and that's where that blood is going to be shunted from my right atria to my left atria, right? So that's what that foramen ovale is doing. That blood is being shunted from the right atria to the left atria, and then it's going to go out to the left ventricle and then out to the aorta and rest of the body. So again, in adults, that structure is essentially closed, so it's just a depression. So that's the fossa ovalis is just a depression. Whereas in fetal development, it's an actual hole where the blood is being shunted, and that's going to be our foramen ovale, okay? So that's why E is going to be our answer choice.